Hello, everyone. I'm Dr. Francisco. I'm live and live in YouTube once more. Today, we're going to talk about what is the treatment of nephrotic syndrome. This is video 62 of this video series on kidney health information and kidney disease awareness to help patients with kidney problems or their relatives or patients that have any other kidney-related condition like type 2 diabetes to understand the disease better so they can come into terms with it, but also by knowing the disease better, they can have more meaningful discussions with their own doctors so to challenge any potential bad outcome that they can have, enhance the path for less complications, what also can translate into less cost for them and less worries. So this is the aim of this video group, so I hope you find it useful. We are now in video 62. We already talked a little bit about nephrotic syndrome. I'm just going to remind you that nephrotic syndrome is a state in which the body gets totally swollen because the kidneys get inflamed and start leaking a lot of protein in the urine. By losing protein in the urine, you get depleted of that protein inside the blood vessels, where the protein works as a sponge for water to keep the water where it is needed inside the blood vessels. So when the sponge effect is lost because the patients are losing the protein in the urine, the water start coming out in other parts of the body when it is not needed. So the body swells up. And there's other symptoms I already discussed. For that, I invite you to check my previous videos on what are the symptoms, the causes of nephrotic syndrome. Today, we're going to talk about what are the treatments options for nephrotic syndrome. As mentioned in the previous video, performing a kidney biopsy is crucial, not only to confirm the cause of the nephrotic syndrome, but to decide on the type of specific treatment required. The specific treatment typically involves the use of steroids and/or immunosuppressive drugs. Both are powerful, not free of side effects, and some of them are expensive. So detailed discussions of their indication, rationale, pros and cons need to take place with your own doctor or with me if you choose me, and definitely requires specialized, personalized advice. So for that reason, because there are many causes of nephrotic syndrome, there are many ways to treat it that need to be really tailored to the specific characteristics of each patient, their health condition, priorities, preferences, possibilities, capabilities, other potential complications, etc. I will not be able to discuss every specific drug used for nephrotic syndrome or every specific regimen for each specific disease. You really need to consult your own doctor or consult me, yeah? But irrespective of the specific treatment for the nephrotic syndrome, and finding that actual cause of the nephrotic syndrome that is targeted to that, other general measures needs to be implemented. For example, there are some antiproteinuric medications that we use. There are blood pressure tablets that have a specific effect on the kidney, reducing the amount of the protein leaked. So they need to be used. Not every patient is suitable for it, but it is ideal that patients are on those medications to minimize the leakage of protein in the urine. Also, the patients, as I mentioned, their body gets swollen up. So restricting fluids is very important, as well as minimizing salt intake. And we doctors prescribe some water tablets, are diuretics, to help your kidneys flush that excess of water. Sometimes work effectively, sometimes a little bit partially, because many of the systems in your body are a little bit swollen as well, and medications might not work as well. Then, but it's important for eliminating the excess of water, for symptom relief, and also minimizing other complications. When the patients have high cholesterol because of the nephrotic syndrome, remember, watch my previous videos to understand why. They need to receive anti-cholesterol tablets, the so-called statins. Because you are losing proteins, patients get malnourished. So enhanced nutrition needs to be implemented also in patients. If there is any other complications, they must be treated. For example, patients can develop infections. I mentioned before, you are losing proteins that are important also for defense against viruses, infections, bacteria, etc. So they must be treated with antibiotics. Some patients, unfortunately, develop clots for example, in the legs, can be also in the lungs, etc. So blood thinners like heparin, analogs, or warfarin needs to be used, but you need to contact your doctor, and sometimes specialists advised by a hematologist needs to be also involved. If there is any other complication or issue, needs to be treated accordingly and separately. So I hope you find this video useful. If so, please share the existence of this YouTube channel, the existence of my live interactive also video group in Facebook. Give me thumbs like, share it. Remember, I also have the written version of these videos. I just published a few weeks ago the second edition of my kidney health and education book. All these topics are there. It's available in Amazon in an accessible cost. You can see it as an investment in your health. You can even give it away to a free to someone that might need this information. If you have Kindle Unlimited, you can just read it there. So my aim is basically to help as many people as possible. So that's why I'm trying to get you through YouTube, get you in Facebook, because in many places of the world, because of the COVID restrictions, traveling, worries, fears, etc., some people might not have access to talk to the doctor or to get some explanations regarding the condition. So my guide is quite comprehensive. Still, I need to add some topics in the future, but little by little, I'm creating something with a simple aim to help people. And whatever money you spend on the ebook is going to be invested on continuing these free initiatives, because obviously there is something behind as well. Yeah. So anyway, I'm Dr. Francisco, and I wish you the best possible health. Take care, guys. Bye-bye. If you have any comment, leave it later.